Hi, my name is Amie Kelsch. Here's my tag, and my assessment is on Hashimoto's disease. This is Shari. She will be my patient. And well, first I'm going to tell you a little bit about Hashimoto's. Hashimoto's is an autoimmune disease that attacks different portions of your body, or it causes your immune system to attack the body. So the system that's affected the most, or the gland, is the thyroid gland, and causes hypothyroidism. It is the leading cause of hypothyroidism as well, and the symptoms are weight gain, thinning hair, paleness, facial puffiness, dry, cracking nails. Some people get a goiter, which is an enlarged thyroid. These are the more obvious symptoms. There's also symptoms that are not quite as obvious, like chronic fatigue and muscle pain. It can also cause constipation, irregular menstrual periods. People with hypothyroid tend to be cold all the time. They also have higher incidences of depression, and their heart rates can get really low. The way that is treated is through some thyroid hormone, different types like synthroid and armour-thyroid and thyroxine are medications that are given to help replace the thyroid hormone that is not secreted by the thyroid because it's not working correctly. Also, having a low thyroid or having Hashimoto's can be attributed to genetics, as well as possible exposure to viruses and things like that they have found that's a possible cause as well of Hashimoto's, and it can lead to cancer of the thyroid too. Serious complications with the thyroid are heart conditions. The thyroid gland helps to regulate the LDL cholesterol in your body. That's the bad cholesterol. So when when you're not getting enough of the thyroid hormone, that cholesterol is not regulated as well, and the thyroid and that can increase, which increases your chances of heart disease, and can also lead to heart attacks. Obviously, emotional problems can get serious with the, if it's not controlled with medications. And then myxedema is probably the most severe problem that can come from having hypothyroid that is untreated. It's a severe hypothyroidism which can lead to coma and death. So first, I am going to assess. Shari is here for a med refill, and just a quick follow-up recheck on her thyroid symptoms and any other symptoms that she might have that might be attributed to Hashimoto's disease. So I'm going to just check her thyroid first, and her neck. So we'll do a neck assessment, a cardiovascular assessment, and an integumentary assessment. Okay, so first we're going to assess her neck, and we're just going to feel for her thyroid gland. So the thyroid gland is located at the base of the neck, it's below the thyroid cartilage, which is also known as the Adam's apple. And a lot of times, if the thyroid is a normal shape or normal size, you won't be able to feel it. But if it is enlarged, or if it's got a node, a nodule, or anything like that on it, then you can definitely feel it. So first, I'm just going to just feel for her Adam's apple, which is right here, and then down there's some cartilage here, and then the thyroid is probably right about here. If you feel the muscles, the sternocleidomastoid muscles here on the side, then you can kind of go follow those down, and then down at the bottom of that, push those muscles away, and then you can kind of palpate either side of the thyroid. But the thyroid is the shape of a butterfly. And so there's two lobes, one on either side here of her neck, and then there's an isthmus in the middle, which connects the two sides. And it looks, or it feels to me like it's normal, cannot feel anything irregular or abnormal. So that's a good sign. Okay, so when assessing the neck, we're first going to look at just inspect her neck, and just to make sure that everything looks symmetrical, everything looks normal, there's no bulges or abnormal lumps or bumps. And it looks like everything's good. I'm going to have her tilt her head back, and that will also help us to see if there's any bulging vessels or veins, as well as her thyroid. Okay, go ahead and put your neck down. She looks fine. And then I'm going to have you swallow. Okay, and when she swallows, you can see the thyroid is located at the base of the neck. So when she swallows, it lifts up a little bit, and so you can see, it there, and there's no extra lumps or bumps or anything that show up when she swallows. We just can see that move up a little bit. So that looks good. Now I'm going to go ahead and check all of her nodes. So she's got nodes located behind her ears. They're called post-auricular nodes, and those feel normal. And then the pre-auricular nodes. Also, there are the occipital nodes back here at the back of the base of her skull. The superficial nodes that are a little bit more just on the superficial area underneath her ears. There are the posterior cervical, which is down here. Those are normal. Her tonsillar, which feel normal. Her submental, which are right here, and her submandibular. And then her deep cervical nodes here, and her supraclavicular nodes. And everything feels normal. She doesn't have anything that's swollen or one side is not larger than the other. And then that is it for our neck assessment. Okay, the next assessment is going to be cardiovascular. And like I said before, the reason why we're doing cardiovascular is because Hashimoto's affects the thyroid, which can affect whether or not your LDL cholesterol is elevated. And so we're going to check for heart disease, since an elevated LDL can cause heart disease. Also, you can have increased blood pressure, you can have a decreased heart rate, things like that, that can also affect your heart because of a thyroid that is not working correctly. Okay, so I'm going to go ahead and check all of her pulses. The majority of her pulses. We'll start with her temporal pulse. You just want to check and feel for rhythm, rate, amplitude, and make sure that they're even on both sides. We'll check her carotid pulses. And you don't ever want to do the carotid pulses both at the same time, because that could cut off circulation to her brain and she would pass out. We don't want to do that. We'll also check her brachial pulses. So what we're doing is just feeling where these major arteries are and feeling the pulses in these arteries to make sure the blood is flowing in the right direction, or flowing the right way, and that it's even all throughout. We're going to check her radial pulse. Those feel great. Her ulnar pulses. And And then other pulses we can check are her femoral, her popliteal, which is behind her knee, her pedal pulse, which is at the top, on the top of her foot, and then her post-tibial pulse, which is just right behind her ankle. Also, with this assessment, we will listen to her different valves of her heart. So first I'm going to listen to her carotid arteries and her jugular veins and make sure there's no, extra swooshes or sounds, bruits that are abnormal that would make us think that there's some kind of a blockage or something in her vessels. But we're going to listen. I'll listen first to her neck vessels, and then we'll also listen to her heart. Okay, those all sound normal. First, we're going to listen to her, I'm going to listen to her carotid, I'm going to listen to her atrial, or her aortic valve, We'll listen to her aortic valve first, which is, if you feel down on the right side of her sternum to the third intercostal space. And we can hear the lub-dub, the S1, S2 of the heart, the S2 should be the loudest, and this is the S2 is the loudest for us here. We're going to go across the sternum to the right side, or to the left side, excuse me, and listen to her pulmonic valve, which also the S1, S2, the S2 is the loudest. We're going to move down to the fourth intercostal space and listen to the Erb's point. Here, the valves, or the S1 and S2, should be equal, because you're kind of right where both valves are, and that sounds great. Then we'll follow on down to the tricuspid valve, which is the it's the fifth intercostal space. We'll listen to the tricuspid valve. On the tricuspid valve, the lub should be the loudest, or the T, or the S1 sound is the loudest. And then we're gonna follow her mid-clavicular line down and straight over to where her this is her mitral valve, listening and trying to do this at the same time. So mitral valve, and also this one, you should hear the S1 sound the loudest. This is also called the apical pulse, where you would check the apical pulse as well. And you can listen to the apical pulse and also check a pulse on the other part of her body and feel if they coincide. And they do. And that all looks good. I didn't hear any abnormalities. Okay, lastly, the thyroid hormone also regulates the skin cells. And so you want to do an integumentary assessment as well. So we'll look at her skin and look for any abnormalities and lesions. The things that we're mostly looking for in regards to the Hashimoto's or the thyroid problems is dry skin. We're looking for dry, cracked nails. We're looking for, in her hair, we'll look for lumps. So the integumentary system is generally an inspection more than anything, but we will feel in her hair on her head to make sure that there's no lumps or bumps or abnormalities on her head, as well as we'll look for color, we'll feel for temperature. So I'm going to go ahead and just feel in her hair, and we'll just feel for any abnormal bumps or lumps or any spots that might be tender, and it feels like everything feels okay. So we're going to look at her skin, look for any extra lesions, any patches that might be dry skin or eczema. That can also be something that comes from a lack of thyroid hormone. Hives are also a sign. If there's a chronic hive, somebody's getting hives a lot, that can also be a sign of low thyroid, and also adult acne. If an adult, all of a sudden is starting to get acne and they can't figure out why, checking your thyroid might be a good option to see if you can figure that out. Her hair is not brittle, doesn't break off, it looks great. I didn't feel any extra lumps or bumps or masses. Her temperature on her skin feels great. She's got good refill, blanchable. All of her skin is I don't see any extra redness or anything like that, but it looks like it's all appropriate. Her nails, there's no clubbing in her nails. If you put your nails together like this, then there should be an opening in between where the cuticles are, and there is. So she does not have any clubbing. Her cap refill, even though her nails are green, her cap refill is fine. It's 3 seconds or less on her refill. And I think that's it. So I think that everything looks great. It looks like the medications are doing the things that they're supposed to. I looked at your labs. Your labs are within normal limits, so the medication is at the right level. So we'll just keep you on that and recheck you again in 6 months.
Okay, thank you.